Hello and welcome, everybody. Welcome to Ask Doc Live. So glad to see so many people waiting and ready to get empowered with information that allows them to be able to help themselves. So we are so excited to have you here today. My name is Rebecca Dukes Kozak, and I will be your host for today's program of Ask Doc Live. We have been running this program for almost 2 years now. July will make it 2 years. And we are so excited with the response that we have received and how every week we have new people that are joining us because the people previously invited others. And that is what this program is all about. We are here to be a resource to help the many, not just one or two, but all around the world. There are things that you can do to be intentional in taking back, reclaiming, or maintaining your own health through the ways that our bodies were designed by the great creator. We are not chemical deficient people. In most cases, when there's disease, it's nutrient deficiency. And I am so excited, as well as my co-hosts, Ruth Ellen Sanchez, Jonty McCollier, Nasima Omar, and Dr. Judy Reynolds. We're excited to have you here and being sponges and taking in this information that you can then utilize for yourself and share with others and what they can do to, again, be empowered. Now, I do want to make a little disclaimer here that the content of this program is not designed to take the place of your primary care physician. It is for educational information only. And folks, our food supply is empty. So if you're not intentionally giving your body the raw ingredients that it needs and deserves, things are going to start happening. And if you've been diagnosed with something that has been tagged as a genetic disease, well, there's this science called epigenetics. And epigenetics has disproven disease and genetics. So yes, there are some things that are in your genetic DNA. Color of your hair, color of your eyes, color of your skin, how tall you're going to be, those type of things. But when it comes to disease, you have more control over it than anybody else is going to let you believe. So I'm excited, as being part of the crew of Ask Doc Live, to be able to bring you this information that, again, empowers you as an individual in your own home, in your own community, and in this world, to be able to help others all around you. Now, if you were invited to this program by somebody specific and you want more information about what you're hearing about today, or there are going to be some products that we recommend that we have found to be proven to bring results, unlike any others. That's the only reason why I'm here. Nothing else worked for me, and this gave me fabulous results. But if somebody invited you to this program specifically, get back with them and say, hey, I want to get on what they're talking about, because I want to choose my health journey. And just a little public disclaimer, we want to keep this as a family-friendly show. So if you're on here live with us and you have your camera on, please pay attention to what you and others around you are doing. We want to make sure that we keep it G-rated. No changing clothes, no getting ready for work, whatever it is that you're doing. Realize that your camera may be on, and we don't want to see everything that's going on unless you are here to talk with Doc and or show your smiling face. So we love those smiling faces. If you're on with us and would like to speak with Doc and you have a camera, be ready to turn that camera on or have it on already. Raise your hand So in this Zoom menu, you will find the option to raise your hand. You might have to click on reactions in order to find that option, but I will be going through and calling on people who have their hands raised and also questions that have been emailed into us and getting answers to the things that concern you most about yourself, your loved one, or health in general. Now, as I mentioned earlier, the genetic theory has been proven incorrect. And through epigenetics, it's the study of how our own behaviors and environment affects the way our genes are expressed. With epigenetics, folks, you are an empowered individual. I can't express that word empowered enough. So many things have taken away your power and made you dependent on something outside of yourself and the way your body was created by the Creator. We're empowering you to take that back. And we invite you to feel the difference with the options that are shared in this program. And it is with great honor to be able to bring to you one of the founding fathers of this science of epigenetics, Dr. Joel Wallach. Dr. Wallach, welcome to Ask Doc Live.
Well, thank you so much for the kind introduction, Rebecca, and thank you to the whole team for being here this morning. I'm excited. We have lots of good stuff to share with everybody. And I want to kind of take a little bit different approach today. I'm going to talk about a bunch of diseases, and you'll say, oh my gosh, he's got a different approach today. Let's start out with Alzheimer's disease. Alzheimer's disease right now, we're spending each year in America, let's see here, $305 billion a year each year just to treat the symptoms of Alzheimer's disease. $305 billion each year just to treat the symptoms of Alzheimer's disease in America each year. Now, Alzheimer's disease is a physician-caused disease. It did not exist until 1960. There were a lot of dementias before Alzheimer's disease, senile dementia and that kind of stuff. People got old and they didn't have a good blood supply and so on. Their memory wasn't good. They get confused. But Alzheimer's disease is a very specific type of memory issue. It's caused by a deficiency of cholesterol. And the reason why it showed up in 1960, doctors made a huge error in falsely believing that the plaque in the arteries was caused by eating cholesterol. So they said, stop eating cholesterol. And pharmaceutical companies came out with a class of drugs called statin drugs to lower your cholesterol. And everybody, the medical doctors put everybody on statin drugs. Okay, insurance paid for it and everybody was happy, right? But then a couple of years later, suddenly now everybody's getting this new disease called Alzheimer's disease. And they're saying now, we're spending right now, as I said, $305 billion a year just to treat the symptoms of Alzheimer's disease in America. But they're expecting within 2 years that to rise to $1 trillion a year, because so many people are still being put on statin drugs and so many people are told to be giving up cholesterol, give up your eggs and don't eat meat and all that kind of stuff. And so I want everybody to stop. You have everything to gain, nothing to lose by getting off of the statin drugs. You have everything to gain and nothing to lose by eating 3 eggs twice a day with soft yolks, where you get your good cholesterol from. Just remember, your brain is 80% fats and 20% protein. In myelin, the white matter of the brain and the spinal cord and the peripheral nerves has very high percentage of cholesterol in the myelin. And so when this myelin goes away, you get all this short circuiting, and Alzheimer's disease is one of the issues. We'll get to some of the other issues in a moment. Okay. Then I want you to think about arthritis. Very common. It's not an aging thing. It's not a genetic thing. It's not a, what should I say, autoimmune thing, except for one disease. Doctors push rheumatoid arthritis as being a autoimmune disease. Well, rheumatoid arthritis is like all other forms of arthritis. It's basically a nutritional deficiency disease, which afflict the joints and cartilage and ligaments and tendons and connective tissue and so forth. But also it has a secondary infection with a bug called mycoplasma, which is kind of halfway between a bacteria and a fungus. And it's actually killable with an antibiotic called minocycline, like the bait fish, minocycline. And so for arthritis, if you just have standard old arthritis, get off all the bad foods, so you can maximize absorption, no fried foods, no processed meats, no oils, no gluten, no wheat, bread, rye, oats, no sugar, no carbonated drinks. Even the diet ones got to go because of carbonation. And the diet drinks neutralize stomach acids, so you cannot efficiently absorb minerals and digest food. But arthritis costs us each year in America $626.8 billion, $626.8 billion a year just to pay for arthritis treatments. Okay. It's a simple nutritional deficiency disease. And so the medical system with arthritis has turned the American population into a dairy herd, and they milk us every day. And so diabetes, or excuse me, let's go back to arthritis. Arthritis is very simple. You know, we have the healthy brain and heart pack. You can add the MSM, you can add the collagen peptides, you throw in the Beyond OsteoFX, throw in the vitamin D3, and you can regrow cartilage. You can regrow ligaments and tendons and connective tissue and bones and bone matrix and bone marrow and all that kind of stuff. You'll be amazed. You know, we treat literally millions of people every year all over the world with our program, and they all get better. Okay, and they're able to get off their medications and drugs. It takes about 6 weeks to get rid of rheumatoid arthritis. I don't care if you've had it for 40 years, you can get rid of it. Don't forget the name minocycline, like the little bait fish, is the antibiotic. You want a 6 weeks prescription for that. You get on the healthy bone and joint pack, or you get on the healthy brain and heart pack, and don't forget to throw in the MSM. Don't forget to throw in the collagen peptides and the Beyond OsteoFX. And then diabetes, we spend each year in America $342 billion a year just to treat the symptoms of type 2 diabetes. Type 2 diabetes is a very simple nutritional deficiency disease. It's not genetic, it's not autoimmune. And there's actually two types of diabetes. One is the classic diabetes mellitus, which everybody knows about. That's the sugar form of diabetes. Okay, your blood sugar goes up because you're not producing enough insulin, okay, to keep the blood sugar down in the normal level. And that's the basic story of diabetes mellitus, okay? And there's another type of diabetes called diabetes insipidus, which has nothing to do with blood sugar. It has no relationship to the cause of diabetes mellitus, which is the blood sugar issue. Diabetes insipidus has a couple of similar symptoms: thirst, dehydration, and increased urine production. Now, diabetes is classic for people increasing their urine production. They'll double it. Instead of having, creating a quart or 2 quarts of urine per day, you'll produce 2 to 4 quarts of urine per day. That's pretty typical of diabetes mellitus. And not only that, you will, let's see here, you'll be thirsty, you'll be dehydrated if you don't drink enough fluids and so on. Well, diabetes insipidus, you could produce 20 quarts of urine per day. You're going to be really thirsty. You're going to be very dehydrated. You'll be in trouble if you're not drinking enough fluid to kind of keep up with that. And it's caused by things going on in your brain. Okay, diabetes insipidus goes along with osteoporosis of the skull, MS, multiple sclerosis. And so it's not uncommon for people to have diabetes insipidus. And, you're having all the symptoms of diabetes mellitus. You're peeing all day, you're thirsty, you're dehydrated, and then they take your blood sugar and it's normal. What's going on here? Well, that's because you've been avoiding the eggs and all the things, that contain all the cholesterol. And so you're short-circuiting your myelin in your brain because there's no there's no insulation anymore. And so that's where diabetes insipidus comes in. It has nothing to do with diabetes mellitus, okay? And that's a crazy thing. And these are things that are very simple to deal with, okay? You have to eat your eggs, nothing fried, no hard boiled. They're going to be soft yolk, soft boiled, soft yolk, soft poached, soft yolk, soft scrambled butter. That's how I have my 3 twice a day. And these are supposed to be adult diseases, but you get them in kids. In kids, it's called Guillain-Barré syndrome, named after two French physicians, Dr. Guillain and Dr. Barré. Okay, they noticed these things in 1916 in kids under the age of 25, and teenage kids, and even 6-year-olds and stuff like that. And so this became the Guillain-Barré syndrome, and it's really just MS in kids, multiple sclerosis in kids, but it's not, kids are not supposed to get multiple sclerosis according to American doctors. And so that's why they gave it the name Guillain-Barré syndrome in kids. Okay. And then that's why we have, again, the healthy blood sugar pack. We have the healthy brain and heart pack. And then heart disease. Gosh, there must be 25 different types of heart disease, none of which are genetic, none of which are autoimmune. They're all associated with nutritional deficiencies. And for diabetes, we spend $342 billion a year. And in heart disease, we spend $316 billion a year, 16.8 billion, excuse me, $316.8 billion a year to treat heart disease. And it's one of those things where, again, that's totally preventable just by getting rid of all the bad foods and taking in the 90 essential nutrients. That's why we came out with a healthy brain and heart pack, so there's no goofing around. I take 2 of those a day. I only weigh 142 pounds. I'm 83 years old. And it's one of those things where if you take all the good stuff and stay away from the bad stuff, again, I don't care if you've been on treatment for heart disease for years, you can make it go away because it's not genetic, it's not autoimmune. Now, it's kind of interesting right now. I'll tell you something quickly here in a moment, because everything is kind of changing in the medical system. Obesity, I was surprised. It's only cost us $210 billion a year. And some people say $260 billion a year. So somewhere between $210 billion and $260 billion a year, what it costs us for medical treatment for obesity. And obesity is not genetic. Obesity is not autoimmune. Obesity is just a simple nutritional deficiency. What do you mean? Oh, deficiency. Well, it's not a calorie deficiency. It's a nutritional deficiency producing a behavior called pica, P-I-C-A, which then causes you to eat and eat and eat and eat because your body's looking for that nutrition that's missing. And when you take the nutrients, the healthy weight loss pack, okay, kind of thing, the healthy brain and heart pack, I like that. And then, of course, we have the let's see here, the keto shake, 1 meal a day. It's not an add-on, it's a meal replacer, and you'll lose a half a pound to 2 pounds a day. And obesity, again, is due to a nutritional deficiency. And you take your nutrients and get on that keto shake, 1 meal a day, you'll lose a half a pound to 2 pounds a day. Obesity is not genetic, it's not obese. Now, I want you to tell you that there's a new syndrome out there now. It's called the metabolic syndrome. Some of you may have heard it, because doctors know they're getting hammered by when they say to somebody, well, you have this genetic disease, and people say, well, we've read there's no such thing as genetic disease. Well, maybe it's an autoimmune disease. Well, we've read there's no autoimmune diseases. So they come up with a new one called the metabolic syndrome. And so what diseases are in the metabolic syndrome? Obesity, diabetes, heart disease, arthritis, high blood pressure, all the things they used to say were autoimmune and are genetic. So now they moved on to the metabolic syndrome because they're getting beat up by their patients when they say genetic or autoimmune. So now they've gone to the metabolic syndrome. And so you'll lose a half a pound to 2 pounds a day, and you'll stay where you're supposed to be if you stay on your 90 essential nutrients, so you don't get that pica behavior back. High blood pressure usually comes along with blocked arteries. Again, blocked arteries are not due to cholesterol. Blocked arteries are due to fried foods, processed meats, oils, glutens. And by processed meats, I mean ham, bacon, bologna, salami, pastrami, pepperoni, jerky, all that kind of stuff's got to go. High blood pressure costs us $131 billion a year. You can go to any store and get a brochure, a booklet, and there's all kinds of over-the-counter medications for high blood pressure and so forth. So you don't see everybody going to the doctor for high blood pressure. You do have some high blood pressure issues that are caused by blocked arteries, not cholesterol, but blocked arteries in the kidneys. And but once you take the Ultimate Daily Classic tablets along with your Healthy Brain and Heart Pack. The Ultimate Daily Classic tablets, I take 3 of those twice a day, and I only weigh 142 pounds. And they will support healthy blood pressure and healthy blood flow through blocked arteries, and your blood pressure issues will go away. MS, multiple sclerosis, thought to be an autoimmune disease by the medical trade, and it costs us $85 billion a year. That's what got me looking into how much all these other diseases cost us every year. Okay, MS, multiple sclerosis, costs us $85 billion a year just to treat the symptoms, okay? And it's due to a deficiency of cholesterol and a loss of the myelin in the brain. They make a big deal of losing myelin out of the brain. They say, oh, it's autoimmune, you're losing your myelin in your brain. No, it's because you've been told to stay away from cholesterol. You've been put on statin drugs. And so you're getting a little bit of Alzheimer's disease and a little bit of MS all in the same time. But also you can have at the same time osteoporosis of the skull. It's interesting that women get 3 times the rate of MS as men. Women get 4 times the rate of osteoporosis, including the skull, as men. Is it a gender issue? No, it's a dietary thing. What do girls do when they go through puberty? Oh, they stop eating fat because they don't want to be fat. They stop eating fried foods because they want nice skin. Okay. And so suddenly now you have MS. Okay. And this is self-inflicted by dietary choices and dietary omissions and so forth. Asthma in kids under the age of 10 costs us $80 billion a year in the United States, $80 billion a year in the United States to treat asthma in kids under the age of 10. Asthma is an extremely simple nutritional deficiency disease. And if you give them, even little kids get asthma, they'll be 3 months old or 6 months old or a year old. Get them on the kids' toddy. The dosage rate per pound is on the back label, kids' toddy. Throw in the cherry mints and use the same dosage material on the label of kids' toddy. Don't forget the EFAs. If they're a little kid, they're just like 3 years old, give them 1 EFA at breakfast, 1 EFA plus at dinner time, or vice versa. And, they're not going to swallow that big soft gel capsule. So you have to puncture the capsule. Don't puncture the kid, puncture the capsule and squeeze that into their kid's toddy, and their asthma will go away, because asthma is an extremely simple nutritional deficiency. And people always want to know, well, which one is it? Well, if you read the books, you'll find out. I don't like to just say it over the air, because people just run to the grocery store, the pharmacy, and they get that one nutrient, and they'll get some results right away. But then later on down the line, the kid or the adult will get other diseases and die because we're only getting one nutrient. Okay. Well, yeah, we take vitamin C every day in our family. Well, what about the other 89 nutrients? Well, we eat well. That's just like saying, well, I put dirt from Texas in my car because it's cheaper than putting 6 quarts of oil in there. So I put 6 quarts of dirt from Texas in there. There's bound to be some oil in there because that's dirt from Texas. Well, we eat the 4 food groups and the 7 food group pyramid, like the doctor says. Remember, doctors have some of the shortest lifespans, especially some specialists. Their average lifespan in America, medical doctors, is 54. You don't want to be following their example and following their instructions. We rank 54th in the world when it comes to life expectancy. Out of all the, I think, like 125 nations in the industrialized world, we rank 54th. There's 53 other nations whose peoples live longer than we do. How can that be if we have the best healthcare system in the world? Well, that's because the medical system has turned the American population into a dairy herd, and they milk us every day. Okay, with that said, I'm going to turn this over to you, Rebecca. And I'm excited because I'm going down through all these common diseases and coming up with these numbers, which are freaky. Okay, and especially for Alzheimer's disease, they're expecting within a year or so we'll be at over $1 trillion a year just to treat the symptoms of Alzheimer's disease in America.
Well, and Dr. Wallach, I just want to point out that that's what the insurance companies report.
That's correct.
That doesn't take into account what somebody might be doing that's paying cash out of pocket. Or
You're exactly right.
On their own. So
yeah, this is the recorded payments. That's correct.
Yeah, that is just absolutely amazing, the amount of money that is spent on disease, folks. Nutritional deficiencies. So when you're taking in this information today, think about all of those red warning lights that you might have going on. Those aches and pains. Just because you've got a pain in your toe doesn't mean that the cause of that pain is not throughout your body. That's just where the weak point is, that's showing where you have something starting. And like I said, red warning light. I love how you put that, Dr. Wallach, the red warning lights.
Yeah, we actually have a CD of that. It's called The Red Warning Light. Goes into, I think, 8 or 9 different diseases and then the early warning symptoms. And pharmacist Keith and I have a new set coming out. It'll be out in about 2 weeks. It's 10 CDs. It's 10 CDs. Each one's an hour long, and each one's on one specific disease, 10 of the major diseases of human beings. And this is our 3 years of collection information. We're kind of excited about it. And so, we'll have the name for you and everything when it's ready to fly. And very, very excited. And of course, you and I have something coming out here pretty soon. I'm very excited about that. And it's one of those things where I think the information that we have coming out, our CD would be just beautiful. It's an add-on to the book It's All in Your Head, because it covers MS and osteoporosis of the skull on the same CD. And that's going to be an added chapter to the book It's All in Your Head when we're getting ready to kind of republish it, because we're running out of copies, so we've got to republish it. But the CD that you and I did, I'm very excited about that. And because so many people have these problems, and doctors don't know. They just don't know these things because they're not taught them in school. And there are no such things as nutritional diseases in America. Come on, America, we have all the food we need. Just eat your 4 food groups, your 7 food group pyramid, and you're fine. Well, unfortunately, nutritional minerals do not occur in a uniform blanket around the crust of the earth, and plants cannot make minerals. I'll repeat that. Plants cannot make minerals. Nutritional minerals occur in the veins like gold and silver. And you could be eating the same recipe in Texas and Missouri and Pennsylvania. And in Pennsylvania and Texas, you'll have 14 different diseases. In Missouri, you might only have 3 diseases, because there's more minerals in the soil in Missouri because of the flooding of the Mississippi and Missouri rivers and all that kind of stuff, as opposed to the dry lands of Texas and Western Pennsylvania. And so you can't, just remember that plants do not manufacture minerals. They can manufacture vitamin C. They can manufacture B vitamins and beta carotene, vitamin A. That's it. They can manufacture protein, they manufacture carbohydrates, but they do not manufacture minerals. If the minerals are in the soil, they'll suck them up. So when we went from wood stoves and fireplaces to electricity, there you go, 3 o'clock in the afternoon, Monday, September 4th, 1882. All the history is in this book, Hell's Kitchen. You and I are going to kind of do another, we're about ready for another issue. Okay, we got a lot of new information to put in there.
Yes. I
And
can't
so
wait to have a revision and update on this.
Yeah, we're going to do, you and I are going to do an update on that. And so Hell's Kitchen tells a story of what happened to the human population when we switched from wood and coal as our fuel to electricity. Well, when we used wood and fuel as fuel, we used coal as fuel, we had ashes left over, and the ashes went into the garden because they were 98% minerals and only 2 or 3% carbon. And the plants would suck up those minerals. And we would also mix the wood ashes and coal ashes into our food, okay, as a spice, but also we're getting those minerals. And that's how we got our minerals. But when we switched over to electricity, suddenly we gave up our source of minerals. And that's when 20 years later, we wound up with all these diseases that doctors started calling genetic and autoimmune, because we never had them before, because we always had the minerals from the ashes, from cooking and heating and that kind of stuff. When we went to electricity, our source of nutritional minerals went away, gone. And so doctors never caught up with that. They're still today, just eat well. That's their mantra. And you never hear a mechanic say that. Oh, come on. Just put some dirt from Texas in your car. Don't worry about it. Everything will be fine. people take better care of their car than they take care of themselves. Okay, so let's get on it. Let's get ready here. And then we will add 25 to 50 healthy years to everybody's life. Thank you so much, Rebecca and team.
Absolutely. And we are so excited, Dr. Wallach, for all of the great things that are coming. And this is only the beginning, folks, of more amazing information that we are putting together as resources to you to be able to take back your health journey and to create healthier communities around the world, because it doesn't take a prescription. You've got it all in your hands. And the information that we're sharing here today is just giving you more tools to use in order to take that control and be empowered. Now, Dr. Wallach, you had mentioned about the food sources and how for plants, if those minerals are not in the soil, the minerals are not going to be in the food, folks. And you have put together Bloomin' Minerals, which come in small containers, comes in liquid, comes in granules, and it even comes in 40-pound bags that we can, again, take on that initiative and intentionally put minerals in the soil for those of us who are home growers and want to make sure that we're eliminating the poisons, we're eliminating the toxins that are going into the food that we are growing.
You can do that even if you don't own property, you live in an apartment, you can use a half barrel on your balcony, okay, and put some potting soil in there and add the Bloomin' Minerals to it, and you'll have healthier food than a farmer.
Yeah, absolutely. And the fact that we have the liquid minerals, Dr. Wallach, for those that are using hydroponics for growing, we just make it even more simple to be able to have those mineral rich, mineral dense foods that go into your body, your temple, because you're worth it. Well, Dr. Wallach, we have so many questions that come into us through email. And I know we have questions from the audience that are here on live with us. So if you are on live, make sure that you find that option to raise your hand. I will be calling on people in the order that I see that their hand has been raised. And we will be going back and forth between email and the raised hands here with us today. So, Dr. Wallach, you had mentioned $80 billion being spent for children with asthma under the age of 10.
Yeah, that's annually. Yeah, that's each year.
Annually. Let's talk a little bit about what specifically would be that protocol. I know you mentioned the kids' toddy, you mentioned the EFAs. Let's talk about food choices.
Okay, well, food choices, kids need high quality protein, so and high quality fats. So again, kids have to have eggs. You can't omit the eggs. And even if you have to mix it into a milkshake or something like that, but I think most kids like soft scrambled eggs with butter and that kind of stuff, especially if they see mom and dad eating it, they want to eat like mom and dad. And so, I grew up on a farm and we had eggs for every meal, breakfast, lunch, and dinner. We had chickens, we would have our own eggs and everything like that. And you have to appreciate, I'm 83 years old and I don't have any arthritis. I don't have any Alzheimer's disease. I don't have any diabetes. I don't have any heart disease. I don't have any kidney disease. I don't have any high blood pressure. I don't have any of these things that most people my age have. Well, why? Because for 75 years, I've been taking the 90 essential nutrients. Okay, for 75 years. I started when I was like 9 years old. Okay. And it's one of those things where I'm living proof that you don't have to get those diseases. They're not a thing of aging. They're not a thing of genetics. They're not a thing of autoimmune weakness. They're just nutritional deficiencies. And so why would you not, for $3 or $4 a day, it's about the same price as a cup of Starbucks coffee, prevent these diseases? And this is the piece that it's so economical to prevent these diseases, and it's so expensive to treat them on a regular basis using the medical approach. So, of course, kids are our favorite people. Parents and grandparents and aunts and uncles love our kids. And so it's imperative that we do treat them well. And again, for just a few pennies a day, you add 25 to 50 healthy years to their life. And if they don't have all these weird diseases, again, like asthma, bronchitis, they don't have skin problems, they don't have behavioral problems. These are all nutritional deficiency diseases. This is not expensive to deal with this nutritionally. It's expensive to deal with it if you're not giving them the nutrients, because you're going to pay an arm and a leg and take a lot of time to have to take them to the doctors and treatment centers and all this kind of stuff. And it only gets worse as they get older.
Absolutely. And you mentioned something that I know, or I have a inclination that the cost of treating another condition that you did not mention that has to do with early onset with children, autism, ADD, ADHD. I have an email that came in here from a mother whose 3-year-old was just diagnosed with autism. Now, there's different forms of autism. There's different behavioral things, so many different levels of this umbrella of a condition, Dr. Wallach, that you personally have had some experience in. Share with us your experience, and I know many have heard it, but many have not. And then 2, what can this mama do to help give her 3-year-old the best possible outcome?
Okay, well, yeah, I before they had names like autism and hyperactivity and things like that, I had them all. Okay, when I was perfectly normal until I was 4. When I became 4, of course, I'm starting to drink soft drinks and all that kind of stuff, and eating what I wanted to eat, not eating what everybody else was eating, and so forth. And so I had behavioral problems, and I got very aggressive, and I would have what would be called very aggressive autism and hyperactivity and that kind of stuff. My mom and dad took me to 20 different doctors over a 5-year period. Not one doctor could help me. And so they decided they were going to put me in an institution and study me. And I didn't like the sounds of that. And so it's a Friday night, they're packing my clothes. So on Monday, they could take me to this institution and install me there. And I said, well, how long am I going to have to be in this place? And they said, well, who knows, maybe for the rest of your life. Well, that didn't sound good to a 9-year-old. So I'm thinking of sitting at the end of the bed and say, well, all the animals in our farm are eating the same thing we're eating. Why don't they have my problems? Why do I have this problem? And then I'm thinking, wait a minute, they get extra stuff that we don't get. They're getting alfalfa pellets with vitamins and minerals in it. So the next morning, Saturday morning, I threw my Cheerios and oatmeal and Wheaties and all that kind of stuff out to the chickens. And I filled my cereal bowl up with the alfalfa pellets with the vitamins and minerals in it. And I had that for Saturday breakfast, Sunday breakfast, and Monday breakfast. By Monday afternoon, I was cured. After 5 years and 20 doctors and thousands of dollars, that was a lot of money back then, okay, of doctors' payments, okay, to the doctors, because we didn't have health insurance. We're farmers, for goodness sakes. And so I was cured in 2.5 days just by taking alfalfa pellets with vitamins and minerals in it. So when I was 9 years old, I knew the doctors didn't know what they were talking about. And that started me on the journey that we're on now, figuring out what we can do to help as many people as we could. Because I was seeing other kids, at school were having the same issues that I was. And, they're getting put on tranquilizers and all kinds of stuff like that. And I wasn't going to do that. I would just, if they gave me stuff like that, I'd just throw it in the toilet. Okay. And so, it's what you say, I don't know if the good Lord set it up to where I figured it out. So I was destined to go on the path that we're on. Probably so. No 9-year-old is going to figure this out by himself. So I probably had a little holy help. And it's one of those things where I found it to be true over all these years. Every time we find something that doctors say are genetic or autoimmune, suddenly now it's just a nutritional deficiency disease, and they have moved over to metabolic syndrome. So metabolic syndrome is obesity, diabetes, high blood pressure, heart disease, kidney disease, dialysis, all that kind of stuff. Now for energy, we created the rebound or sports drink for Theo Ratliff. Okay, he lost his contracts with he's a basketball player. He lost his $30 million contract with the Atlanta Hawks because he had bone about arthritis of both his knees. Cartilage popped off his hip. He fractured his shooting arm wrist, and they took his contract away from him. I came up with the Healthy Bone and Joint Pack. I came up with the rebound for him. 3 months later, he gets his, not 3 months, a year later, he gets his position back. And he, over 11 years' time, he made over $100 million using my program to maintain his health and top performance. And so why shouldn't all the other athletes in America, whether you're in grade school, high school, university, Olympic athletes, professional athletes, why shouldn't they be using my programs? Because it just costs a few bucks a day to put your body in a position to maximize your income. And just like MS, per person, it costs $40,000 to $60,000 a year to pay for the treatment for MS, multiple sclerosis, for a person. With our program to treat MS, I treat dozens of them a month, not hundreds, but only dozens, because they go to their doctor, they're afraid, so they go to their doctor. And so the ones that I treat, it'll cost them $2,000 a year instead of $40,000 a year. Is $2,000 a year better than $40,000 a year? Of course it is. Okay. And if you eat right and supplement correctly, then you won't have to be on any medication. Now for kids, again, going through what I went through again, that's why we came up with Kids Toddy, because in my day, I was 9 years old, and so I could do things, but I was crunching up alfalfa pellets and using them as snacks and just in my pocket and eating them like M&Ms. I was just eating alfalfa pellets, all the vitamins, minerals in it. But for breakfast, instead of oatmeal or Wheaties or Cheerios, I was using these alfalfa pellets with the vitamins and minerals in them, putting milk on them and using the alfalfa pellets as a breakfast cereal. Okay. And so it's one of those things where the proof is in the pudding. And so again, how much do I spend every year on medication? Zero. I'm 83 years old. I don't spend one penny. We have health insurance because Youngevity, pays for health insurance for everybody. And so it's one of those things, but I don't need to use it because I don't have any health challenges that I can't fix or prevent with nutrition. Okay. And so everybody can do the same thing. This is not just a Wallach thing. This is a human thing. And so we can't thank Rebecca and her team enough for letting us be on with them every Friday and sharing the information, because we're getting the information out there. It's very obvious. And don't forget the kids. They're not going to eat 25, 30, 40, 50 capsules and tablets and powders twice and 3 times a day. And so that's why we came up with the Kids Toddy. It tastes good, tastes kind of like lemonade, and kids love it. You got to watch it. They'll drink the whole quart, but give it to them based on the weight dosage formula on the back label, and use the same formula for the Cherry Mints. And don't forget the EFAs, very important. EFAs prevents blood clots, helps make normal skin. Kids, preteens and teenagers with acne, get them, on those EFAs, get them on the 90 essential nutrients, and the acne goes away. Why should they be on antibiotics and pain relievers and skin creams and all that kind of stuff? I'm not sure I understand.
Oh, Siri, go to sleep.
Yeah, go to sleep, Siri. I said, where's she come from?
Well, Dr. Wallach, as a kid, I had rabbits, and I remember eating those little alfalfa pellets. They didn't taste bad at all. And so that was, I get it. I totally get it. And making sure that our kids are getting what they need. But most importantly, Dr. Wallach, I've had some people say, well, they're young. I want them to experience everything that's out there and not keep them from it. Well, giving your kids that free reign, and especially they're not the ones buying it, folks. At 5, 6, 7, even 12 years old, they don't have the money to go out and buy all this junk food. So who's putting the junk food in front of them? And you're doing more harm than good when it comes to their adult health experiences and even childhood experiences. So we as parents, grandparents, adults, aunts, uncles, we need to set that example and teach them what needs to be taught as far as the nutrition for healthier living.
You said it perfectly. Now, one of the things I've said here a few times and people didn't hear me, okay? And that is, let's say you've lost your job. You have no income. How are you going to go to the grocery store and buy food? You're going to go to the grocery store and steal food? No, don't do that. What you want to do is go to the grocery store and buy cans of complete dog food. Get the moist dog food. It's kind of like hamburger, okay? And it's got all the vitamins and minerals in it. It'll cost you 25 cents a meal, okay? And so this is not difficult, okay? I would be the first one to start eating dog food. If that's all that was left in the grocery store, I would do it, okay? Because they put all the vitamins and minerals in there. There's billions of dollars worth of research. Back over, 100 years ago, the average dog in a household would live 4 or 5 years of age and then die because they're giving them table scraps and that kind of stuff. And the dog would go find a rat every once in a while themselves. But when they came out with the dog food, okay, with all the vitamins and minerals in it, suddenly now dogs are living to be 12 and 14 years of age. And now they're living to be 17 to 20 years of age because they're getting more nutrition in their dog food. So don't, always keep about a dozen cans of dog food in the house, even though you don't have a dog, because if you need to fill in a meal, guess what? You're getting all the nutrition in that can of dog food. And eat like a dog.
Well, and Dr. Wallach, you have often said, I may treat you like a dog, but you do get better.
That's right. That's where I got that.
Well, we have a question here, Dr. Wallach, from Melanie. She says, female, 55, 5'6", approximately 350 pounds. Her legs are weak. She has failing slurred speech. Doctors are now calling it a functional neurological disorder. She can't walk. She does try to walk with a walker, but mostly is sitting because she doesn't want to fall, and she doesn't have a gallbladder. So, Dr. Wallach, what would we recommend for Melanie?
Okay, well, Melanie needs to stay away from all the bad stuff. No fried foods, no processed meats, no oils, no glutens, no wheat, no whatever I know, no sugar, no carbonated drinks. The diet one's got to go. I'd have her get 1 meal a day. It's a meal replacer, not to add to a meal. It's a meal replacer, 1 keto shake per day. Okay, and that same meal, if she's eating a keto meal, she can take, say, 2 servings of our Rebound or a sports drink with 100 nutrients in it. And then I want her to have 2 Healthy Brain and Heart packs per month, a full dose of everything twice a day. I want her to get 2 bottles a month of the MSM, so you can take 3 at breakfast, 3 at lunch, 3 at dinner time. I want her to, let's see here. I also want her to take the collagen peptides, a scoop in her morning drink, scoop in her evening drink. I want her to take vitamin D3, 3 of those twice a day, so she can absorb the minerals and put them in the right places. And she'll lose a half a pound to 2 pounds a day. on this regimen, and it'll be noticeable. Okay, but she does need to eat eggs. I want her to eat 2 or 3 eggs twice a day with soft yolks, not hard boiled, not fried. Soft yolks, soft poached with soft yolks, soft boiled, soft yolks, soft scramble and butter, soft yolks. And she'll lose a half a pound or 2 pounds a day. Don't forget that keto shake, okay? And again, just one, and she'll lose a half a pound or 2 pounds a day. And it's going to save her an enormous amount of money, okay? And I also would like her to use our minerals or plant-derived minerals. She could use our cherry mints, okay, liquid cherry mints, or she could even use the Z radical. Go use the Z radical, get 2 quarts a month, so she can take an ounce at breakfast, ounce at dinner time. Z radical is made from, I don't know, 8, 9, 10 different seaweeds and stuff like that. Has some weird trace minerals from the ocean, but also it's a great detoxifier. When you lose that amount of weight, you're going to have to detoxify as you go along. And that's where I would go with her, and she'll do fine. We deal with 300-pound people, 400-pound people, 500-pound people all the time. Maybe a dozen times a year, I'll deal with a 600-pound person. Okay, and the record for weight for women is 1,200 pounds in America, and in men it's 1,400 pounds. Okay, is the heaviest weight on record for one human being. Isn't that crazy? And this is all caused by nutritional deficiencies because they have this behavior called pica, and they just never stop eating. They're even eating when they're sleeping. Okay, and that's why they weigh so much. And so it's one of those things where you get up, you know, you're 5'6", and you get up over 300 pounds, you're in big trouble. Okay, and so you could die of a blood clot in any moment. You could die of a hemorrhage any moment. You die of high blood pressure any moment. And so you want to make sure that you get this down safely and quickly and do it nutritionally. The doctors thought they were helping her by taking her gallbladder out. You got to be kidding me. So she really should take our ultimate enzymes, which has, we call it the gallbladder in a bottle for people who had their gallbladder removed. It has bile in it. We've taken from the slaughterhouse from beef cattle. And so she needs to take, say, 2 or 3 of those, say 5, 10, 15 minutes for each meal. The ultimate enzymes, the gallbladder in a bottle to replace her gallbladder. Shame on those doctors. What the heck did they think they were doing, taking her gallbladder out? Oh my gosh. I guess his kid had tuition due.
And you know, I myself have not had my gallbladder removed, but I've had gallstones, which are horribly painful.
Mm-hmm.
And I am thankful that I said, no, you can't take it. But before knowing any better, Dr. Wallach, I had my appendix removed.
Okay, why did you have your appendix removed?
Well, they said that it was ready to burst.
Why was it ready to burst?
Well, it had to do with my diet. And I know now it's because I was severely gluten intolerant.
Well, the only people who are not severely gluten intolerant are dead people. Everybody's gluten intolerant. Not
and
just
I was too young to
you.
go dead. Yeah. So, and let's talk about that, Dr. Wallach, before we go on break. And I know Ruth Ellen has her hand up with some questions also. People are asking about oat milk and oatmeal all the time. What about the ones that say they're gluten-free?
No. People should be put in jail if they say they're gluten-free, because the gluten in oats is called gliadin. Okay. Is a projectile just as deadly as a bullet? Come on, it's not a bullet, it's just a projectile.
Yeah, it's just the name you give it.
Exactly.
And for those folks that don't know, gluten is a protein. Gliadin is a protein. Our bodies cannot break down and digest. So it creates this gooey substance that lines the insides of our intestines, takes the villi that's supposed to be absorbing all those nutrients, it coats it, it compacts it. I love your analogy, Dr. Wallach, of the water hose, from a shag rug to a water hose.
Yep.
and taking all that surface that's supposed to be absorbing all those vital nutrients that we put into our body.
Instead of a shag rug, it looks like a plastic tube.
Yeah, it's incredible. Absolutely incredible, Dr. Wallach. Ruth Ellen,
Ruth Ellen.
go ahead and unmute yourself. You're on
Okay.
live with Dr. Wallach.
I'm there. Thank
Hi.
you for taking my question. Okay, so I have a couple questions. One of my distributors, who's a very dear, sweet friend of mine, has superficial. Okay, first of all, she's female. She's 30 years old and she weighs approximately 120 pounds. She is gluten-free and she does not have any gray hair or varicose veins or anything like that that I am aware of. She has superficial fissures on the palms of her hands, and her lips are cracking right here at the corners, edges of her mouth. And she has acne on her back that can be quite painful. Now, the superficial fissures had gone away, but she recently went under a very stressful life situation that is coming to a close. And so, you know, she works with her hands, she types, she works in an office, so it's interfering with her job. What should she do?
Okay. Well, to her 90 essential nutrients, I don't know if she's taking the let's see here, the Healthy Brain and Heart Pack, or she's taking the Healthy Start Pack.
She's taking the Healthy Body Start Pack.
Okay.
Selenium and a glucogel.
Okay, I'd move her up to the Healthy Brain and Heart Pack, go from 90 nutrients to 215 nutrients, okay?
Mm-hmm.
I want her to take the MSM, take 3 twice a day. If she only weighs 130 pounds, take 3 twice a day. That'll help her with her skin, with her arteries, her veins, including the cracks around her mouth and her hands and so forth. Wouldn't hurt for her to take the hair, skin, and nail. You need to ask her, do you color your hair? She may be coloring her hair, you know, 2 nights a month and doesn't tell you.
She does color her hair, but she doesn't like the Brazilian blowout, so some of her hair is dark and not colored.
Okay, we'll see the problem,
again.
Ruth Ellen, yeah, the problem is here, okay, when you have even one white hair in your ear, okay, that's an early warning signal that you're deficient in some nutrients, okay? It has nothing to do with aging. Everybody thinks, including doctors, that when you get white, gray, and silver hair, that's an aging thing. No, it's due to nutritional deficiency. And when you start getting your hair color coming back, without coloring your hair, that's telling you that you're absorbing the nutrients again, okay? And so she needs to kind of step up a little bit here. Don't forget the collagen peptides. That's also going to help her with her skin. Don't forget the MSM. Don't forget the Beyond OsteoFX. Don't forget the glucogel. All that kind of stuff, you know, in addition to the Healthy Brain and Heart Pack, is going to help. Okay. And she's got to stay away from the bad stuff. You can't say, well, I'm doing all this good stuff, I should be able to cheat once in a while, right? No. It's just, no, you don't want to shoot yourself in the head once a year, because that's not going to work.
She actually gets violently ill if she eats any gluten. Like,
good.
Yeah. She's very cautious because of that. Now, I have another question, but we are at the top of the hour, and I'm happy to wait until after the break.
Let's wait. Let's keep our system going. So let's wait on that. You'll be the first one that Ms. Rebecca brings back on, okay?
Okay, works for me. Thank you.
All right, and we are going to be going on a break. And folks, if you were invited by somebody specific to watch this program, whether you're on live with us or whether you are watching the replay, make sure that you get back with the person that shared this program with you. They cared enough to say, hey, I saw this program, I thought of you. So get back with them and say, hey, thank you so much for sharing this information with me. I want to learn more. I want to get on a program like Dr. Wallach is talking about and take control over my own health journey. Now, if you were not referred by anybody specific and you found this program as being part of our newsletter through the Critical Health News or Ask Doc Live, or one of our YouTube channels, you can go to Ask Doc Live, click on Contact Us. So that's askdoclive.com, our website, click on Contact Us. On our website, we do have a store for those that have never purchased from the longevity product line and have not, especially not spoken to anybody about longevity or any of the information that was here spoken about today. We will be right back after this break. You are watching Ask Doc Live. Dr. Wallach, you beat me back. Welcome back, everybody. And Dr. Wallach, so somebody put in the chat that 60 years ago when they were in high school, they had a science teacher who brought out the dangers of eating white flour. And she said that they had removed all the nutrition from that flour. And that is found in the bran, and they were feeding it to pigs. So they were taking the nutrition out and giving it to the animals. So that was 60 years ago, Dr. Wallach. People, some people had a clue.
They had a clue. They knew something was wrong. They didn't get it exactly right, but they weren't taking the nutrition out. Okay. They weren't taking the gluten out, but it's one of those things where the bran, had a certain amount of nutrition in it that the grain itself didn't have and so forth, but they knew there was something wrong. They had a clue that there was something wrong. And so they were bright enough to see that if you just, ate white flour, you had problems that you didn't get if you ate other things. And so, we ate a lot of potatoes. We ate a lot of beans because we had gardens and we grew our own sweet potatoes, white potatoes. We grew beans of all kinds. We had cucumbers. We grew our own tomatoes. We grew our own corn for ourselves, differently than from what we grew out in the field. We grew cabbage. Let's see, what else did we grow? Let's see, I think, we had trees, of course. We grew apples. We grew apples back then. We had berries, strawberries. We grew strawberries, that kind of stuff. And so that's, there's advantages to growing your own food. And so you can, again, use the bloomin' minerals. And that's a great source of nutrition in your own food. Plus, it's kind of therapeutic because, instead of watching TV all day and night, to, watch your tomatoes grow. It's a wonderful thing to see your tomatoes grow, to see your cucumbers grow, and so on. And it's a great education for kids to see that kind of stuff and to participate in growing them and to be responsible for fertilizing them with the bloomin' minerals. And so, even if you live in an apartment, you can have a little garden and a half barrel on your porch or your balcony or whatever, or in a bathroom that has a window to get some sunlight during the day when you lock up the place and leave to go to work.
Absolutely. And for those that are doing it outside, getting some fresh air, getting some sunshine, some vitamin D. Not too much though, Dr. Wallach. For
That's
some
right.
of us who don't get to see sunshine very often and we go and enjoy it, we get burnt. But
that's because you're so tender.
We just have to be careful. Yes, very tender skin, that's for sure. Well, Dr. Wallach, let's go back to Ruth Ellen so she can come and share with us her next question.
Okay, hi. Ruth. Hi, Ruth Ellen.
Hi. Okay, so I have this other woman that someone called me about yesterday, and she did not get back to me with any information about herself. I do know that she's willing to go gluten-free, but that's about all I know as far as her health. But she has a labral tear in her hip socket. And I don't know anything about that, and I was wondering what would be a good thing for her to do. Her doctors, I guess I have a little tiny bit of information because of the person that called me and told me about her. Her doctors told her that there's nothing that they can do to fix it.
Okay, well, I haven't seen the x-ray, but when a doctor says it's not fixable, I don't believe that 90% of the time, okay? And so you have to appreciate that a hip joint is kind of interesting. It's got a ball on the femur, the leg bone, that goes into the hip socket, and there's a capsule. There's a connective tissue capsule that surrounds that joint, okay? And it produces joint fluid, which lubricates the joint, and you can have a tear in that capsule, okay? Because you can twist the leg in a funny way or something like that and tear that capsule, or fall and twist that and tear that capsule. So that's possible. But what you want to do is give the body what it needs to repair that tear, okay? So let's just go by 100 pounds of body weight. I don't care if she weighs 125 pounds or 200 pounds or 300 pounds. Let's go by 100 pounds of body weight. She's get rid of all the bad foods, no fried foods, no processed meats, no oils, no glutens, no wheat, no rhinos, no sugar, no carbonated drinks. Even the diet one's got to go. And I'd have her take one healthy brain and heart pack per month. I'd have her get an extra bottle of our selenium per 100 pounds of body weight, because it's got these 5 cofactors in there, one of which will help repair connective tissue, including the capsules and heart valves and arterial walls and skin and things like that, okay? And then I also, per 100 pounds of body weight, want her to have 1 bottle a month of the MSM. So you can take 3 at breakfast, 3 at dinner time, again, to help repair that joint capsule in the hip. That's going to help her with all her joints all over her body, help her skin, help her hair, help her intestines, help her arteries. And then I want her to, let's see here, take the collagen peptides, 1 scoop of that in her morning drink, 1 scoop of that in her evening drink. I weigh 142 and I do that. And then for discomfort, she can use our CM cream topically on that hip. It'll relieve inflammation and pain for a couple of hours. We also have the Soothe from our Hemp FX division, which will relieve pain and inflammation for about 4 hours. So I like people to take the CM cream every couple of hours during the day, and then a half hour before bedtime, use the Soothe from our Hemp FX, and they'll get 4 to 6 hours of good relaxation rest at night without having to wake up because of the discomfort. And so that's what I would recommend there. Give all the raw materials necessary to repair connective tissue, tendons, ligaments, and of course, the capsule that covers the joint of the hip is very similar in chemical composition as the walls of arteries, the ligaments, tendons, connective tissue all over. So it should respond properly. Okay, so that's where I would go with that.
Okay, thank you.
Mm-hmm.
Then I had another question that's not related to anyone in particular. It's just something that I've noticed with a few people that I've worked with and with myself, is that sometimes a person will go through a huge shock, a scare, something horrific happens, and they get traumatized, or just severe stress, and like have no gray hair, and then all of a sudden, almost overnight, they have this white streak of hair, like the size of a dime or a nickel or a quarter, even sometimes just all of a sudden appears almost overnight. And I was just curious, what causes that? Because it's
if it
so
happens
sudden.
overnight, okay, if it happens overnight, it's because they're so traumatized, they forgot to color their hair that night.
Okay, thank you.
Okay, because you can't lose your hair color the whole length of the hair. It's one of those things that starts at the scalp, and as the hair comes out, over days and weeks, you'll start seeing some gray hair.
Mm-hmm.
Okay, so if it happens overnight, that means that they didn't color their hair that night.
Okay, so if it took a couple weeks and it just seemed like overnight to this person.
Yeah, okay, well, they need to take their nutrients to get some hair, skin, and nails. Use
Okay,
that.
perfect. Thank you.
Mm-hmm.
All right. Thank you, Ruth Ellen.
You're welcome.
So Dr. Wallach, John has a question here. What causes shingles?
Shingles is a virus infection. And usually people have a low immunity because they're not taking all 90 essential nutrients. They're eating the bad foods, can't absorb nutrition from the food because they're eating gluten. And they get exposed to somebody that has the shingles. And so the virus jumps onto them. And it's, just a typical virus infection. And this is where the colloidal silver comes in. You can put it right on if there's no alcohol in it, so it won't burn. You can put the colloidal silver with like a cotton ball or a Q-tip, put around the lips or skin, anywhere, the back, underneath your eyelids, wherever you have the shingles going on. You put the colloidal silver and then put 2 droppers full under your tongue 30 minutes for each meal and 30 minutes for bedtime. And take all your nutrients, support your immune system, stay away from the bad stuff, no gluten, and shingles goes away. It's just a simple little non-fatal, it's just a frustrating viral infection, but it's telling you that there's something going on. You got to detail the details, okay?
And Dr. Wallach, I have some personal experience with shingles, but I had it in my eyes. And this was something the year before I found you, I was experiencing shingle occurrences almost every 3 weeks. And it was the most painful experience in my whole entire life. And I got on the supplements, I got the colloidal silver, and it has been almost 6 years since I have had any evidence of any type of issues with my eyes.
No
and it
shingles.
starts out feeling like you've got sand in your eyes.
Mhm.
And then it just gets worse and worse. So you can't open your eyes. So it's just a testament to what your body can do when it's given the right stuff to ward off attacks.
Mhm.
So
Yes, we were
that's a great
given
question.
a lot of defensive methods and materials and tissues and stuff, but they require nutrients to be able to function.
Yep,
Like
absolutely.
you can have an M1 tank, it can shoot an artillery shell 5 miles, but it can't do anything without the artillery shell.
That's right. That's right. And what we put in our bodies, those minerals, folks, that's the currency of life. You take those minerals out and you forget to put them back in, you're cutting yourself short. So I don't know how else to put it.
Well, tell our new people that come along, how much weight have you lost on our program?
So, and I was going to mention something about that earlier. So just getting on the program, Dr. Wallach, in the first 3 months, I lost 20 pounds.
Wow.
And I hadn't made any changes. I didn't know that I was gluten intolerant at that time. I didn't know that I had to, take those things out because I wasn't a junk food eater. I just kept gaining weight. Didn't know why. And now I know. And I'm glad that you had added on the plant-derived minerals earlier when we were talking about weight loss. Is when my body got those minerals, I no longer had those cravings for sweets. I no longer had those cravings for the salty foods, the starchy foods, the fried foods. It was like a natural appetite suppressant that helped me make wiser choices in what I was putting in my mouth.
Wow.
So it's fabulous. I was one of those people that were pushing 300 pounds.
And you've lost how much weight now?
100 pounds.
Over 100
Lost
pounds.
100
Wow.
pounds.
And you're so
Yeah,
beautiful.
so-
Thank you so much.
Well, thank you so much. I appreciate you and all you've done and all of the work of the distributors that have come before me to make sure that your information is out there and available. And that is the goal of this program on Ask Doc Live, is to continue making sure that this information is available on a bigger scale than a belly to belly scale. I mean, so many people have done so well in this industry, just talking to people individually. Well, that's not good enough for us. And because of our amazing co-host, John T. McCollier, who has those technical skills and making sure that the masses get reached through digital marketing, I am so blessed to be a part of this team where we are reaching around the world, Dr. Wallach, and it's our honor to be able to present this information to others. So thank you for hanging in there.
Thank you for you and your team.
Opportunity to do what we love and do best. And that includes sharing this message, Dr. Wallach. So the next question that I have here, and I really do think we need to do a pet episode, because we get so many pets coming in or questions coming in, and with you being the person that you are and starting out in the animal world, and then taking and having that initiative to say, hey, I've got all of this information about mammals, and then doing the research to see how it correlates with humans. I mean, there's no better person to ask these questions to, in my mind. So I foresee a pet episode, Dr. Wallach.
Okay.
Just giving you
Just
a heads
pets,
up
yeah.
there.
Okay.
Just
no problem.
pets. Just pets.
No problem.
So
I worked in zoos and aquariums for 25 years, so I know a little bit about animals. My thesis is in the Smithsonian Institute as a national treasure.
that's right. That's right. So, and all those data points and pathology reports and how you came up with the essential nutrients that the body needs, that needs to be heard, because it wasn't just a whole list of things that you pulled out of the clouds and said, okay, we're going to take this, this, and this, and this, and say that they're essential. No, you actually have the research to back what the body needs, and when it's missing, what dysfunction
You
and
pay
disease.
the price. You will
That's
pay
right.
a price.
Pay the price for. So, yeah. Next question has to do with the cookbook, Dr. Wallach.
All right.
So share with us a little bit about what brought this cookbook around.
Okay.
And how you
right.
got your name on it, because you're not the author on this one, but your face is right there.
Okay. Well, this is actually an accumulation of the data of a 3-year study that the 3 professional chefs in Eastern Canada and I did. This was a wager. Okay. I'd been lecturing in Canada, gosh, for 20 years. And these chefs started showing up in my lectures and challenging me during the Q&A periods on my thoughts about gluten and cooking and all this kind of stuff and fried foods. And these were 3 professional chefs. They had restaurants that they owned. They were on TV programs and stuff, very famous chefs. And I said, well, you're questioning what I'm saying here. Let's have a little wager. Let's do something. I'll come up with my recipes on some paper, and you come up with your recipes on paper, and we'll give your customers and your restaurants their choices. And so after 3 years' time, we correlated all the, they would sign the paper and they would check the marks and stuff on there, so we knew what they thought about the meal, either it was gluten-free or had lots of gluten or whatever, or fried or not fried or steamed. And so we correlated that data. It was 3 years of data. And they said, well, what are we going to do with all this stuff now? I said, well, let's put it into a book. And so we together wrote the book, and I let them be the chefs, which was the incentive for them to do it, because if I did it, they weren't going to cooperate very well. And so I said, why don't you guys be the chef? And of course, Chef Norman was the chief of the 3. And I love what they wrote on the outside back cover of the book. Okay. And that tells the whole story. Yeah, please. That tells the whole story. It's just a couple of small paragraphs. Go for it.
So Chef Norman says, I have worked in the culinary industry for well over 20 years. When I first encountered Dr. Wallach's food recommendations, I believed it was impossible to cook that way. In the food industry, oil and gluten are obliquous. Whatever. Fortunately, I was wrong. And in the last 2 years, we have recreated every dish I can think of without the forbidden ingredients. We have gone back to the basics of cooking, and we have fit Dr. Wallach's recommendations into all of the methods I was taught in chef school. I have done my best to include as many variations of traditional recipes, so this book should be able to feed a family a huge variety of healthy food that also tastes good and retains the textures we know and love.
Yeah, as ubiquitous.
Thank you. See, we're going to keep you around, Dr. Wallach.
And so, yeah,
we have almost 300 pages of recipes here.
Exactly. It's 300 pages of gluten-free cooking and fried food-free cooking. And I get so many compliments on how nice these foods taste and everything. And it's a blessing because these 3 professional chefs really went way, way, way out of their way to come up with good recipes that were gluten-free and fried food-free. And so I have to give them a compliment. They didn't try to sabotage the deal. They really did a good job, and I'm very proud of them.
Well, and this one that I'm looking at is even gluten-free Parmesan crusted oven baked pork chops.
There you go. Woo!
I mean, some of these things in here, you know, omelets and waffles. And when you think waffles, you don't usually think gluten-free, but they're in here. You've got Tuscan bean soup with squash and kale. Which reminds me, Dr. Wallach, one thing that I found that, you know, after gardening for so long and being raised on an orchard, to go to the grocery store and purchase food and then try to eat that food, it just does not have the flavor that it would have if you were growing it your own and making sure that the soil that you are using to grow your food in has the nutrients that
Bloom and minerals
need. And the Bloom and Minerals makes it simple.
Yeah.
So.
And so just remember, if you buy 10 of those books, you get a big discount. And so they make great presents for holidays. They make great presents for promotions and babies being born. And anytime somebody, or there's a gift due, give them one of these books, but you can get a big discount on them if you buy 10 or more. Okay, so remember that when you order. Let me just get 10 of them or 15 of them or something like that. And begin, you know, you put your name in there or staple your business card to it. And, you know, start, you know, working on people to help them with their health. And you create a community, gluten-free community. It makes a huge difference.
Yeah, most definitely. So yeah, wedding gifts. I mean,
Absolutely.
now is wedding season. And you can find Dr. Wallach's most popular books on our website, askdoclive.com. Or we have the drjwallach.com for all of Dr. Wallach's publications. So we encourage you to visit those 2 websites to get more valuable information in a text form that you can actually have in your hands, black and white, and be able to read it. And I can't wait until we have that in audio, Dr. Wallach.
Wow.
So not just your lectures, but the books themselves. So I foresee that coming as well. We have a hand that is up, and I'd like to go all the way up into Canada, Dr. Wallach.
Okay.
And ask Hilda, who is with Christine. They have questions for you. So Hilda,
Okay.
Go ahead and unmute yourself. And if you have a camera, perfect. Go ahead and bring you on as well. So you are on live with Dr. Wallach.
Sorry, we're cooking, so go ahead.
We cook.
All right, what question do you have, Christine?
I'm I have my heart race a lot and started pounding, and I have an enlarged left ventricle, and I have varicose vein. I just want to find out what can I do.
Okay, have your doctors given this pounding in your left ventricle a name, like anything like atrial fibrillation, tachycardia? Have they given it any name?
No, they were saying something about me, the electrical system. That's why my heart racing anyway.
Okay, how much do you weigh?
I'm probably about 150, around about 150
Okay, is this pounds or kilos?
pound.
Okay, 150. Okay, because Canada, I have to ask. Okay, then do you have any other issues? High blood pressure, diabetes?
No, I don't.
Okay, do you have any bowel problems? Irritable bowel syndrome, celiac disease, constipation, diarrhea?
Yeah, just noticed I'm getting constipated now, a couple of months ago.
Mm-hmm. Okay, and then do you have any ringing in your ears? Any ringing in your ears? Any tinnitus? Any ringing in your ears?
Yeah. Sometimes my ears, sometimes my ears sort of ringing
Okay.
anyway. Sometimes, not all the time.
Just comes and goes. Okay, what about balance problems, or vertigo, dizziness, any of that?
No, maybe once, whatever anyway, but not really. No.
Okay, all right. Let's see here. Do you have any white hair,
I
gray
have
hair?
varicose vein. I have some varicose vein too anyway too.
Okay, veins. Okay, yeah. Okay, and let's see here. How old are you? What's your age?
59, just turned 59.
Okay, congratulations. Okay, yeah, I believe you have osteoporosis of the skull. That causes these ringing in the ears, the tinnitus, buzzing, comes and goes. And osteoporosis of the skulls squeezes the 10th cranial nerve, the vagus nerve, which causes irregular heartbeat. Some doctors will just say you have an irregular heartbeat. Some doctors will call it atrial fibrillation or tachycardia, fast heart rate, bradycardia, slow heart rate. And it's the skull squeezing that nerve, which controls the rate and rhythm of the heart. You ever have any stomach pain?
Christine, can you go ahead and unmute again? Christine, can you unmute again, please? Hilda, can you help her unmute? I'm sorry. There we go. Do you have any stomach pains, Christine?
Yeah, sometimes, not all the time anyway, but I have fibroid too anyway too, fibroid, so.
Okay, what about things like, let's see here, anything going on with lungs, any hiccups?
No.
Okay. Anytime do you ever get like your voice changes and you kind of feel you're kind of tight in the throat, anything like that?
I'm going to lots of phlegm. When I have phlegm, maybe that's the issue. Sometimes I have
Okay.
problem with phlegm.
Okay,
When I
yeah.
eat wheat and stuff like that, it even flare up more.
Well, you're not supposed to eat wheat. Wheat has gluten in it. You cannot eat wheat. What you want to do is you have any wheat at home. You want to gather up all the wheat you have in the house and give it to your doctor.
Yeah, give
with
them
love. Give the wheat to your doctor with love. Okay. Okay. Well, here we go. None of the bad foods. No fried foods. No processed meats. No oils. No glutens. No wheat. No brown rye oats. No sugar. No carbonated drinks. Even the diet one's got to go. And at 150 pounds, I want you to have 2 healthy brain and heart packs per month. 2 healthy brain and heart packs per month. The full dose, I think, twice a day. I want you to get 2 bottles a month of our MSM, so you can have 3 at breakfast, 3 at lunch, 3 at dinner time. And they will support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, including the valves and the heart.
You guys, you get it right. Can you
I've got it.
Repeat so we can write.
Can you
please repeat for me that I'm writing it down now?
I'll get the information to Hilda, Christine. We can watch the replay.
Okay, great.
also at
Okay, great.
AskDocLive.com. Go
Thank
ahead, Dr.
you.
Wallach.
Okay. So get rid of all the bad foods. Then I want her to have the 2 healthy brain and heart packs.
Excuse me.
Okay, I'm going to
What
stop.
about oats? Get rid of it.
I'm going to stop because you keep interrupting me. Let's go to another caller.
Okay, I won't interrupt.
I'm done.
All right, Dr. Wallach, do you want to finish the protocol? I do have her muted if you want to finish that protocol.
Thank you. Okay. Yeah, she needs to also be taking the collagen peptides, a scoop of that with her breakfast, a scoop of that with her dinner time. I want her to have the Beyond OsteoFX, take a scoop of that in her morning drink and her evening drink. Okay. And I do want her to have 3 eggs twice a day of soft yolks, so she can actually kind of rebuild the myelin in her brain. And she should be getting plenty of all the other nutrients she needs in the 2 Healthy Brain and Heart packs. Okay, let's move on.
All right. Thank you, Dr. Wallach. Next question has to do with diabetes, Dr. Wallach. So John says he has had diabetes since he was 20 years old, and has been fighting to control it through pharmaceuticals, which aren't working right now. His A1C is still at 10.6, even on the pharmaceuticals that they have him on and insulin. And he would like to know, what can he do nutritionally in order to help himself?
Okay,
Now,
does he say how much he weighs?
he is 146 pounds at 5'11". So he's very thin.
Mhm. Okay, all right. And so, and usually, you know, they have other things going on, but they never say, oh, I have high blood pressure, but it's under control with medication, but they never say that. They just don't say anything, okay? But at any rate, when you have diabetes, A1C 10.6, it should be down around 5. That's where you want to be, is 5, certainly below 6. And 146 pounds, it needs to get rid of all the bad foods, no fried foods, no processed meats, no oils, no sugars, no carbonated drinks, even the diet ones got to go. 2 Healthy Brain and Heart packs per month, 2 Healthy Brain and Heart packs per month, the full dose, everything twice a day. I'm going to have the MSM, 2 bottles of our MSM, take 3 at breakfast, 3 at lunch, at dinner time. That's going to support and promote maintenance repair, cartilage, ligaments, tendons, connective tissue, including in the walls of arteries and the tubes in the pancreas and kidneys and all that kind of stuff. And then I want him to have take 3 of the sweeties twice a day. Okay, so he'll need 2 bottles a month of the sweeties. Okay, take 3 of the sweeties twice a day, and this will help him if he's on medication. Like he says, he's taking all this medication, and the reason why the medication is not working is because he's eating gluten. His intestines are dead, and he cannot absorb even the nutrition. He cannot absorb medication. And so he's got to get rid of all the gluten, no wheat, no barley, rye, and oats. I mean, this will be forever. And so things will begin to work at that point. And if he's on medication, don't cold turkey off the medication, but as the blood sugar drops, as the A1C drops, you can slowly reduce the medication based on the numbers. And it's usually going to take anywhere from 4 to 6 weeks to get off the medication. But how long do you have to stay on the 90 essential nutrients? Forever. How long do you have to stay away from the bad foods? Forever. Okay. And so it's kind of like, how long do you need oxygen? Forever. How long do you need water? Forever. And so this is a concept that people have to have, is these nutrients are not something you just take when you're sick, and then when you get better, you can stop taking the nutrients. You cannot get these things from your food. That's the problem. Fruits and vegetables do not make minerals. Fruits and vegetables can make a few of the vitamins, but they can't make the minerals. Nutritional minerals do not occur in a uniform blanket around the crust of the earth. They occur in veins, like they occur in veins like gold and silver. And so it's imperative that you constantly proactively take, I call these essential factors. I don't like to use the word supplements, because supplements mean, well, I'm just going to add something to what's going on here to speed up the healing. No, you want the essential factors. You want them every day for the rest of your life, not until you just things looking better. Okay.
Absolutely, Dr. Wallach. Thank you so much for that. Now we have Richard, who has written in, and Richard's 56 years old. 225 pounds, 65 years old. Did I say that? 65 years old, 225 at 5'12", 11. Sorry. He says 6 foot. So 5 foot, 6 foot. He says he has an enlarged prostate and he has fractured both shoulders, one last year and one just yesterday. What nutrients does he need in order to strengthen his bones, Dr. Wallach, so he can stop fracturing shoulders? He doesn't include what happened that caused the fractures, but I know there's a lot he can do to strengthen his bones overall. What?
Well, he's got to
recommend?
stop jumping off the 3rd floor and landing on his hands. Okay. So, 225 pounds, 5'11". He's pushing it a little bit. Okay, I'd like to see him weigh 185, something like that. So he might be 25, 30 pounds overweight. If he wants to, he could take 1 meal a day or keto shake. It's a meal replacer. It's not to add to a meal. He can have a rebound or sports drink, 2 of those at the same meal as a rebound shake. He'll lose a half a pound to 2 pounds a day. And then at 225 pounds, he needs 2 healthy brain and heart packs per month, full dose everything twice a day. He needs to take the MSM, 2 bottles a month, so he can take 3 at breakfast, 3 at lunch, 3 at dinner time. They will support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, discs between the vertebrae, bone matrix, bone itself, and including the shoulders. And then he needs a collagen peptides. Take a scoop of that with his morning drink. Take a scoop of that with his evening drink. He needs a vitamin D3, 3 of those twice a day. That will actually help him absorb the minerals and put them in the proper places. And so let's go there.
All right. Thank you so much, Dr. Wallach. Now, Audrey has a question here, and I
Okay, Audrey.
can get some more information as far as her age and weight. But she has been told that she has calcium deposits in the breasts. And she's wanting to know what would cause that. And she was just recently started a calcium supplement. But now they're saying that she has them deposits in her breast, and that was just this last week. So let's go, I think 55 years old. 125 pounds, I think is what I was told yesterday.
Okay. Anything else? High blood pressure, diabetes, asthma?
No other ailments.
Mm-hmm. Okay. Well, I want to know, did she have the same examination before she started taking calcium and she did not have any calcium deposits in her breast? And then she started taking calcium, and then 3 weeks later, she started getting calcium deposits in her breast. I need to know that, and because were they there before she started taking calcium? Okay, we'll get a hint.
That we don't know, but she did just mention borderline diabetes.
Okay, pre-diabetes. Okay. All right. All right. So she needs to make sure she's staying away from all the bad foods. No fried foods, no processed meats, no oils, no gluten, no wheat, bran, rye, no sugar, no carbonated drinks. And then, let's see, I want her to get a hair analysis. She can get the book Rare Herbs and Cures, go to chapter 10. It'll tell her how to collect the hair, how to package it, where to ship it. Don't forget to put the check in there because they won't run the test without the check, kind of thing. And then I want her again to get 125 pounds. I want her to get 1 healthy brain and heart pack per month, half a dose of everything twice a day, except for our selenium. I want her to get another bottle of our selenium with the 5 cofactors in there, not from Walgreens. Our selenium with the 5 cofactors in there. So she can take 3 twice a day or 2 3 times a day for a total of 6 a day. Then, of course, she has pre-diabetes. I want her to get 2 bottles a month of our sweeties. So you can take 3 at breakfast, 3 at dinner time. That should bring things around there. And I want to see what the hair analysis says. But calcium deposits can be caused by hemorrhaging. Okay, if she's wearing a tight bra. Okay, or doing belly flops, kind of stuff like that, and landing on her breasts and causing hemorrhage. And the hemorrhage is, of course, when the hemorrhages begin to clot and and so forth, they turn into calcium deposits. Okay. And then let's see here. So there's many, many possibilities there.
Dr.
When you-
Wallach, I just got a message saying that years ago she had a brain aneurysm.
Okay. Well, an aneurysm, whether it's in the brain or heart artery or an artery in your abdomen, aneurysms are caused by a breakdown in the elastic fibers in the walls of the artery. And so I would suspect that she had some gray hair, even at 55 years of age. It's not an aging thing, it's a deficiency of nutrition. The same nutrient deficiencies can wind up causing aneurysms. And so that's why I want her to take our selenium, okay, with those 5 cofactors in there, because those cofactors will prevent aneurysms, okay? And also can help your body reverse aneurysms when they're there. The diabetes, pre-diabetes, I want her again to get 2 bottles a month of the sweeties. So you can take 3 at breakfast, 3 at dinner time. And that's going to bring things under control there. But to maximally absorb stuff, she needs to get rid of all the gluten, no wheat, no barley, rye, no oats. There are no such things as gluten-free oats. The gluten in oats is called gliadin, but it's still gluten. And so she's got to watch cross-contamination in the laundry at home, the food preparation surfaces at home. She cannot work in a bakery. Okay, anything like that, she's got to watch it. No gluten in her environment, no gluten going into her mouth. Okay.
All right. Thank you so much, Dr. Wallach. We appreciate that. And the last 15 minutes, Dr. Wallach, let's go ahead and grab just a couple of these pet questions, because I just looked it up. And in 2022, $316 billion was spent on our pets, Dr. Wallach.
Now, is that for health issues?
It just overall. So
Is that 1 year?
We're talking 1 year for food, all of the niceties that pet parents like to spoil their pets, fur babies with, doctor bills, that includes everything spent on pets.
Mm-hmm.
So one of the questions has to do with shedding. She mentions that her dog sheds a lot. First of all, what would cause shedding?
Okay, well, the skin and the hair follicles require an enormous amount of nutrition because the hair is growing all the time. There's a lot of biological activity in the hair follicles. And so here's a case where these animals need to be getting, these home pets, dogs, cats, need to be taking our Arthritis. It's 1 scoop for 20 pounds of body weight. It's minerals and vitamins. It's in a granular form. And then also we have the hair, skin, and nails. Don't be bashful about giving the dog or the cat hair, skin, and nails. I would go ahead, for a 50-pound dog, they could have, say, 2 or 3 of the hair, skin, and nails per day in the food. And if they push them off to the side, just open them up and pour the powder, into the food and mix it up. That's why I like moist dog and cat food. That way you can mix powders in there and they can't separate it out. When you try to put powder onto a dry dog food or cat food, they learn that they can knock the food around and the powder falls to the bottom. Okay.
All right, Dr. Wallach, thank you so much for that. The next question is from Miriam, or her sister has a 6-month-old puppy and only 1 testicle appeared. Is this a nutrient deficiency?
Okay, the odds are this is caused by nutritional deficiency during the pregnancy. If there's 6 pups, or if there's 10 pups who are competing for the nutrition, and it's not unusual for 1 testicle not to descend, or maybe not even form. Okay, so that may be up in the body cavity, and you need to do a scan or something like that to see if it's in there. Is it worth it? Do you want to really know? Is it worth paying the cost of a scan to see if there's a testicle up in the abdominal cavity? Okay, it could be that it just did not descend, or it could be that it didn't form at all and it just only got 1 testicle. It's like a lot of babies are born with 1 arm. Babies are born with 1 leg. Babies are born with 1 toe. kind of thing. And so babies are born with one eye, okay? And so you can be born with one testicle. You can be born with one ovary. And so there's many, many answers to that question. But like I say, it could be still up in the body cavity and just didn't descend because of lack of nutrition during the pregnancy, especially if the mother was getting table scraps or not getting enough nutrients from the dog food and so forth. And
then we had a question in regards to dog food, Dr. Wallach. What, and also cat food, what are the specific things? I know we don't endorse any particular brands, but what things do we want to look out for and staying away from?
Look out for and stay away from gluten. No wheat, no barley, rye, and oats. You can have rice in there. You can have beans in there. You can have corn in there. You can have potatoes in there, but no wheat, barley, rye, or oats. Okay, that's the main thing.
You know what I found on some labels that I was looking for is there was a lot of them that include corn oil and soybean oil added in for the omegas.
Yeah, and of course that's a sad thing because it's when you give them those oils every day, okay, these oils oxidize over time. They oxidize and turn into trans fats, heterocyclamines, and acrylamides, and cause all kinds of inflammation and cause cancer and kind of stuff like that. Just like it does in humans, it also can occur in animals.
All right, and one more question in regards to pets, Dr. Wallach. Drooling, excessive drooling, and nervousness, heavy breathing, and this pup it's a black dog, has white spots, like lack of pigmentation. What would you recommend?
Okay, that's called vitiligo. Human beings get vitiligo, okay, where you get little white spots on dark skin, okay. And so, yeah, basically, here's a dog that's not getting the nutrition it needs. It's got osteoporosis of the skull. And so drooling, okay, has to do with the ninth cranial nerve, okay, because the tongue and the throat should be swallowing that saliva. The fact that it's drooling means that the throat is tightening up, the tongue isn't working like it's supposed to. That's the ninth cranial nerve being squeezed by osteoporosis of the skull. Nervousness and heavy breathing, again, that can be osteoporosis of the skull. It could be a squeezing of the 10th cranial nerve, the vagus nerve, which can cause asthma, bronchitis, COPD, hiccups, and all that kind of stuff in animals, just like in people. Okay, so people have those questions for their animals. They need to get a hold of the book. It's all in your head, because the information on what happens when you have pressure on the 12 cranial nerves in the spinal cord in humans, the same thing will happen in dogs and cats and elephants and sea lions and tigers and bears, oh my, okay? And so this is the sort of thing I learned when I was doing those autopsies in the zoos, looking for environmental problems with chemicals and pollution, okay, to give warning to people in the cities. And that's why my thesis is in the Smithsonian as a national institute, okay? And okay, it's in the Smithsonian Institute, okay? Because I showed that there were no genetic diseases, there were no autoimmune diseases, these things are all nutritional deficiencies in all these species. And so it didn't matter what species were, the same nutrient deficiency caused the same symptoms, okay? And so this all comes down to nutritional access. And so the gluten factor comes in. Well, I'm giving them, the supplements, but read the label. Oh yeah, there's oats in there. Well, that's why, because there's gluten in the oats, can't absorb the supplements. Okay, and so that's the problem.
And Dr. Wallach, you mentioned your book that's in the Smithsonian Institute, which most of us probably cannot afford to get our own copy of.
Yeah.
But you wrote the book Epigenetics and took a lot of the information that you put in that and made it into a publication that we can afford, that we can get in our hands, that has proven the death of genetic theory of disease transmission is incorrect. I mean, the transmission of it is incorrect. Epigenetics.
Yeah, and epigenetics, yeah, that's what I say is the summary of my thesis. It's in the Smithsonian Institute and brand new.
Right,
And the
right
one,
here.
yeah, the one, oh my gosh, would you look at that? Epigenetics, yeah. Yeah, that one is a summary of my thesis, which is in the Smithsonian Institute. It's a weird title. The one that's in the Smithsonian Institute is The Diseases of Exotic Animals. You can go to Siri and say, Siri, are any of Dr. Wallach's books, Diseases of Exotic Animals, available for sale? And they'll pop up. They'll get some that are beat up and old and weathered and riding in the margins and dog-eared. And they'll sell for $1,300, $1,500, $3,000, $5,000. In fair shape, they'll sell for $5,000 to $8,000. In good shape, they'll sell for $8,000 to $10,000, $12,000. Brand new in the box, still unopened in the wrapper, $25,000 to $35,000. And so you want to get a hold of the book Epigenetics. It sells for 25 bucks. That book that you have holding up, it sells for 25 bucks. But if you get 10 of them, you get a big discount. Okay. And see, I think I have the numbers here. It's one of those things where you can give them as gifts. And so, okay, yeah, if you buy 10 of them, the price drops down to $15 each. You save 10 bucks on each book. You save 10 bucks on each of those epigenetics. And so it drops from 25, which is the price if you buy one. But if you buy 10 of them, they're only $15 each. Okay. And so it's one of those things where you want to make sure you get a hold of that book, because it goes into just about everything we talked about. In the 1,200 page book, it was actually 5,000 pages, but the editors, W.B. Saunders, which is at the time the biggest medical textbook publishing house in the world, they bought the rights to my thesis and published, I think, like 90,000 copies and sold them all for 25,000 bucks each in just less than 6 months. Now, how did they do that? Well, that's because that showed that there were no genetic diseases. It showed that there were no autoimmune diseases. And they were all the diseases that were said to be autoimmune and genetic were really just simple nutritional deficiency diseases. And that started that whole new science, which you pointed out that I'm considered one of the founding fathers of that science of epigenetics. So thank you so much for bringing that up.
Well, thank you, Dr. Wallach, for, not stopping at exotic animals, although I think we are all, at one time, we started out as exotic animals. Now
Yep.
we have populated the earth and no longer have that exotic title. But thank you, Dr. Wallach, for making this information available that we are able to put to good use in our own lives and in the lives of those that we love. We have a hand up. We have 5 more minutes.
Okay, let's go for it.
Go ahead and go to Marita. Marita, go ahead and unmute yourself. You're on live with Dr. Wallach.
Good morning, Dr. Wallach, and blessings to you. And
Thank you.
thank you so much. Thank you so much for all the work that you've done and helping us get back into health. Sorry, I'm here in Palm Desert, California, and it's so hot right now. And I have the air conditioning in the windows and trying to air out. But I thank you so much for bringing this service to us. Because
How can we help you today? How can we help you today?
anyways, I have restless legs, and I've heard you on the George Noory show teach us more about what we do for our restless legs. I was a healthy gymnast and runner that went from 110 pounds to 165 pounds after getting bronchitis because I was put on so much Solu-Medadrol, prednisone, and you name it, every bronchial thing. And the doctors had a heyday with me on every type of cortisone and steroid medication you can imagine. So it has been a whirlwind of trying to get my legs at a peaceful rest and trying to get this extra weight off.
Okay, stop. Let's see here. How tall are you?
I'm 5'4".
Okay. Do you have any other issues? Diabetes, high blood pressure?
No,
Any ringing in your ears? Any tinnitus once in a while?
always ringing in my ears.
Okay, I thought so. And any dizziness or vertigo now?
No, thank God.
Oh,
We got that
okay.
under control.
But you did have some.
Yes, on and off.
Okay. Now, do you ever get hiccups?
Yes.
And when they come on, do they last for 5 minutes or 10 minutes or a half hour or what?
No, less than 5 minutes.
Okay.
I can calm them down.
Okay. All right. Okay. Well, you have, and when you say you have, let's see here, lung issues, correct?
And restless legs.
And restless legs, lung issues and restless legs, correct?
Correct.
Okay. Now, you have osteoporosis of the skull. The skull is squeezing the spinal cord. That's what's causing the restless leg. The spinal cord is being squeezed way up here, and you're causing downstream the restless leg syndrome thing. The doctors are trying to treat it by treating the restless leg syndrome when really they need to be working up here. Okay. They missed it by 4 feet. Okay. Okay. So at 155 pounds, you got to get rid of all the bad foods, no fried foods, no processed meats, no oils, no gluten, no wheat, bread, rhinos, no sugar, no carbonated drinks. Even the diet one's got to go. And then I want you to, at 155 pounds, you're right at that cusp. Since you've been troubled so long on medication, I want you to take 2 healthy brain and heart packs a month, 2 healthy brain and heart packs a month, the full dose thing twice a day. I want you to get 2 bottles a month of our MSM, so you can take 3 at breakfast, 3 at lunch, 3 at dinner time. And they will support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, discs between your vertebrae, bone, makes your bone itself, including the skull. I also want you to get our MSM. I said MSM. I want you to get our collagen peptides. Take a scoop of that with breakfast, scoop of that with dinner time. And that's going to help you with bone matrix, the bone marrow, and so forth, your immune system. I want you to also take our vitamin D3. Even though you live in California, I want you to take vitamin D3, 3 of those twice a day, so you can absorb these minerals and put them in the right places. And all of these problems are going to go away because your skull is squeezing that spinal cord, okay? And that's what's causing the problem downstream, okay? And so the doctors are trying to treat downstream and they're missing it by 4 feet, okay? Okay, so
Okay.
if you would do that and then call us back every couple of weeks, because you are going to have a great story.
I am going to call you back, and I have been taking your products as well. And I was running out, so I wanted to hurry up and talk to you before I purchased other things to try and get my health elevated back to the way I used to be. So thank you, Dr. Wallach.
Okay, well, thank you. We look forward to hearing from you.
You will. Alrighty. Bye-bye.
Bye-bye.
All right, thanks, Marita. Now, Dr. Wallach, we are at the end of our show. One more time. It's been a fabulous Friday, Dr. Wallach, and I just look forward to every Friday where we are able to come together and share information that empowers others as individuals and communities and the world to take control of their health.
Well, I can't thank you enough, Rebecca, for you and your team. You and your team do such a great job helping the world all over the place, and I can't thank you enough. And let's look for 600 years to keep going. Let's
do it. Everybody, you have been watching Ask Doc Live on behalf of myself, Rebecca Dukes-Kozak, and my co-hosts, Ruth Ellen Sanchez, John T. McCollier, Nasima Omar, and Dr. Judy Reynolds on with us today. We invite you to feel the difference. If you have never tried any of the products and you were not referred to this program by somebody specific, you are invited to go to AskDocLive.com. We have a store there that has all the products that Dr. Wallach mentioned today. We also have a contact us that you can ask your specific questions. One of our certified holistic health coaches will get back with you in getting what you need to meet your individual goals. And for those who would like to speak with somebody, we do have a call team standing by at 855-949-7234. Again, that's for people who have never spoken to anybody about longevity or the products that were mentioned on this program today. If somebody referred you to this program, get back with that person. They have their own special ways of ordering, or they're in contact with their great health coach who has taught them that there are things that they can do, and they're sharing that information with you. So get back with the person that invited you to watch this program. On behalf of the Ask Doc Live crew, have a very blessed week, everybody. We will see you next time. And if you want to watch the replay of this program or any of our programs that we have been recording almost exactly 2 years now, right, Jonty? You can go to askdoclive.com and you'll find all of our programs there, including Dr. Wallach's most popular books. Everybody, God bless and bye for now.
Bye-bye. Thank you so much.
Thank you, Dr. Wallach.
Love you. Bye-bye.
Love you too.
Thank you, everyone. Bye-bye.
Bye-bye, everybody. Love you.
Love you.
Bye-bye.